According to the Ministry of Health, whereas there has been progress towards the 95 triple targets, which are 95% of people living with HIV should know their status, and 95% of people living with HIV should be started on treatment, while 95% of people living with HIV should be able to suppress their viral load. This means that they are taking their treatment well. However, these targets are lagging behind among the children, which might also hinder Uganda's goal to end AIDS by 2030.
Have slightly above 50% of children who are living with HIV globally who are on treatment. And in Uganda, we are about the same picture. So that's why I mentioned that the HIV cascade for children who are living with HIV lags that of the adults. So the same thing for all the other indicators.
Mother-to-child transmission remains a challenge, with 4,000 new infections registered among children last year, although there is a reduction from the number in 2010. The Ministry of Health says the number remains high and more efforts are needed.
We still have about 20,000 children who are living with HIV who are out there that we need to identify, and we know that statistics tells us that if you do not start these children on treatment by 1 year, you've lost 30%. By 2 years, you've lost 50%.
We insist on testing immediately at birth and ensuring that the mothers and the babies are on treatment, because we all know that when you're virally suppressed, you're unlikely to transmit, so that they are free to breastfeed for the recommended period of time. But of course, we have cases that escape these initiatives or interventions, and they are not on treatment, and their babies are not on treatment, but they still breastfeed, and we end up with HIV infection.
Nobat at Kunda, NTV News.